Ma'am.
Here we go. We're live. It's preparing, gearing up now. Hi, Doc.
Hi, how are you, Bernice?
I'm so excited to be here today talking about one of my favorite new finds, hormone balance. Does anyone in Northern New Jersey want to feel stronger, younger, and improve your interest in sex? Scandalous. Raise your hand really high if you're one of those people. That would be me. So today, Doc and I are here to talk to you about hormone balance. This is not only important for women, but for men. So if you're a man, do not leave the room. In this video, we're going to talk to you about why hormones help you be stronger and younger, why they can help improve your interest in sex, how to restore your natural sleep patterns, huge deal for me, how to maintain healthy bone density, what can hormone balance do for you, what you do once you find there is an imbalance of hormones, and any myths you may or may not have heard about hormones and the correlation to cancer. And those who stay on till the end, we will share the fastest and easiest way to balance your hormones. But before we get started, I guess we should introduce ourselves. My name is Bernice Donato, and I am a certified life coach and the co-founder of Origin Wellness Center. Doc?
My name is Dr. Nancy Lentine, and in addition to my private practice, I am co-founder with Bernice of Origin Wellness Center. I've been in practice for over 30 years, taking care of patients with hormone imbalance. This part of my practice has been the most rewarding, and I love taking care of patients with hormone imbalance.
Well, I guess I just want to disclose I am one of those patients. We will be talking openly about that today. And this is one of my favorite topics because it has made such a huge difference for me. So before we jump into that, I want to invite everyone to take full advantage of us by asking questions. Don't feel shy. There's no silly question. Just drop them in the comment section below for us. Let us know what it is you're curious about. I'm sure those questions will certainly help other people. So, and don't forget, if you're watching this on the replay and you have a question, know that Doc and I will personally be answering them as soon as we have an opportunity to do so. So let's get started. I can't tell you how excited I am about this. So what does it mean? Let's start there. What does it mean to have hormone imbalance? And what are the signs we're looking for? I didn't know what signs to look for.
Well, before we even get started about the hormone imbalance, let's talk about what are hormones. What do they do? The definition of a hormone is it is a molecule that binds to a receptor site on a cell, and it creates a series of reactions within that cell. So depending on the cell, will determine what that cell will do. So like if it's a bone cell, it may tell the cell to start reproducing or start dividing. If it's a skin cell, it may tell that cell to make collagen. So hormones are kind of like messengers, and it tells certain cells, it turns them on or may turn them off. So if sometimes if there's an imbalance, that hormone may bind to that receptor site on that cell and not turn it on or not turn it off. And that's what we call imbalance. Or we may have too much hormone or not enough hormone, and that receptor cell is getting mixed signals. We have hormone receptors all over our body, in our brain, in our skin, in our heart, our lungs, our intestinal tract, and our female hormones for men, our male testes. So we have cells all throughout our body that our hormones are constantly sending messages to. So it's a no wonder when we go over what an imbalance, what it does, how it affects us in multiple areas. So for women, we could start seeing hormone imbalance, in the young teenage years with PMS or irregular periods, acne. It can cause headaches or menstrual migraines. As we get older, we can develop into endometriosis or ovarian cysts, uterine fibroids. Hormone imbalance can lead to infertility. As we get older, it can make us feel warm, or we can have full-blown hot flashes or night sweats. It can interrupt our sleep. It can create brain fog, vaginal dryness, hair loss, irritable bowel, whether it be diarrhea, constipation. It can affect our sleep. And it affects men too. What we call, in the medical field is called andropause. So if anyone knows of anybody that might be showing signs of low testosterone, just give us a shout, let us know about that. But for men, it could be fatigue, erectile dysfunction, hair loss, thinning bone, and yes, men do get osteoporosis, anxiety, depression. So it can affect both men and women. Like I said earlier, with memory issues, insomnia, fatigue, skin aging, circulation, loss of muscle, an increase of body fat, mood changes, and it can exacerbate certain psychological conditions, psychiatric conditions such as schizophrenia or bipolar. Hormone imbalance will disrupt your life.
I don't want to step over something that you said a moment ago, because for me, one of the things we'll talk about today is dispelling myths. And I thought that, for the longest time, I thought that hormone imbalance can only happen to older women. And,
No.
You cleared that up for us, very nicely above. And I think even some of the symptoms that you talked about, low muscle, I would never, and issues with your gut, like irritable bowel stuff, I would never have associated that with a hormone imbalance.
Yes, and that's what I want to make sure everyone is clear on, because like I said earlier, we have hormone receptors on our entire body, and it affects us in so many different ways, and everyone's different. You could have a progesterone imbalance or deficiency and it present in one way, and I could have another way and present in a totally different way. So, we're all made up differently. We're all genetically different. And so this imbalance can affect, basically the entire body.
I mean, I think it begs the question, when should we get them tested? When should we be talking to our doctor about hormones?
Well, before we even talk about when we should get it checked, I just need to clarify something. Not all doctors are trained to check hormones correctly. One would assume a gynecologist or an endocrinologist, has the knowledge on, hormones and hormone imbalance and when to get it checked. But it doesn't mean that they're bad physicians. It's just that they weren't trained. I did a fellowship in functional medicine, and basically what that means is that we look at the reasons behind why a body goes dysregulated and why a body isn't functioning properly. And part of my training was hormone health. So I have extensive training on hormone health. Or, some physicians can also get certified in hormones too. But just make sure that, if you want to get your hormones checked, that you should get it checked by somebody who's qualified and trained properly. But getting back to your question, I always love to get baseline hormones checked in your 30s. And for women, it should be, a certain time of the month. But for men, it could just be a random time. But it's something that you would generate a conversation with your provider as far as getting a baseline hormone level check. And it shouldn't just be the hormones. It should be what we call the building blocks of hormones too. The building blocks meaning, we need certain molecules in order for our body to make hormones. And that also should get checked as well.
Yeah, I mean, I love, thank you so much for the injection there on the doctor. It's so important to be dealing with someone. You know, it's funny when we leave our kids with someone, we wouldn't leave them with an axe murderer. Like, we always do that background check. We find out who it is. We make sure we know some things, that they've got some background, that they know what they're doing. But oftentimes when we go to a doctor, we're like, oh, it's a doctor. No, that doctor may not have specific training, you know, in this. And it is an area that, if not understood properly, could have some impact. So you want to know that your doctor does have some additional knowledge around it. So how does a person, we talked about when, but how does a person get their hormones checked?
So, most hormone trained providers will start checking female hormones through blood work. If a woman has irregular periods or no periods for that matter, then that's a conversation that you would discuss with your provider as to when to, get your hormones checked, what time of the month. For men, it's just a simple blood test. And like I said earlier, it's not just getting the hormones, the estrogen, progesterone, and testosterone level done. Hormonally trained, a physician will check the building blocks or the precursors, such as DHEA and pregnenolone, as well as even want to get the metabolites of how we metabolize hormones, because that can impact one's life and create its own symptoms. So not only you want to get your hormones checked, but you want to get the precursors and the metabolites, what we call the metabolite, checked as well. Okay,
so what do you do once you find out that there is an imbalance in your hormones?
Well, a traditional doctor may put you on, for females, may put you on a birth control pill or give you a prescription with a fixed hormone dose. Obviously, that's not my preferred method. Once we find out based on those levels, we would put them on a dosage that's specific for them. And it's made by a compounding pharmacy. For women, it may be either, from a traditional standpoint, it'll be a pill or a patch. For men, it would be a cream or an injection. But from a functional medicine provider, it may be in the form of a cream or a lozenge or a capsule, or our newest man on the block is a pellet. For men, we would do either a cream or a pellet. But know, like, the difference between these different delivery systems, because they aren't all created equal. Whether it's a cream or a pill or an injection or a lozenge, you apply it or you ingest it, and you're going to get a peak level, and then it's going to drop. You get a peak, and then it's going to drop. If it's an injection that's done once a week, for instance, you're, at 3.5 days, you're going to peak, and then it's going to dip. If it's something that's done twice a day, you're going to get a peak and a drop and a peak and a drop in that 24-hour period. A pellet is a little different. That is something that is injected underneath the skin, and the delivery system is so superior because it's based on the body's natural needs. For instance, if someone is, very active, you're going to need more hormone. That just makes sense. Or if you're sleeping, for instance, you're not going to need as much hormone in the evening as if you were active. So the beauty of this pellet system is that it restores the body's natural needs as to what it demands, the body demands. And this is what we call hormone optimization, which basically means that the body gets the hormones when it needs it and if it needs it. It really mimics, Mother Nature. If you're younger, for instance, though, you may just need the building blocks. You may not need the actual hormone. But, as we get older, our body doesn't make those hormones as efficiently as it did when it was younger. So you actually need the hormones in order to get that optimal level.
I couldn't agree more. I mean, and I love that you introduced here the part about, the difference between the creams and the hormones, the creams and the patches. And, as my physician, I have tried all of those methods and have had success. Initially going in, I was really, I was going through some personal challenges in my life. So the additional stress and the cortisol, along with, the FSH changes, which are the hormones that begin to change when a woman does go, am I saying that correctly? Perimenopausal?
Yes, perimenopausal youth.
And, for me, I got some relief from those things. The symptoms I was struggling with were night sweats in particular, hot flashes. Oh my goodness. It feels, someone was trying to explain it to me. I think it's a very accurate explanation. It's as if the inside of your body has gone into a 5-alarm fire. And it's the kind of thing that makes you it stops you. It really does. It's a very disruptive, thing to have happen. I had a plethora of symptoms, and I got some relief, as I said, from the patches and the creams, but the pellet was far superior. One of the things you talked about before was the mental fogginess. I did not have any relief whatsoever from the creams and patches with that. The pellets are the one notable thing that, on a scale from 1 to 10, 10, being the worst of my symptoms, right? I would say that I probably got a 6 or 7 out of the creams and patches. And this is just me, my personal experience. But from the pellets, I'm normal again. I'm normal again. I'm going into my 3rd round now of them. And I think because I had been so deficient for so long that it took my body a couple of rounds, but as each week goes by, I notice more, like I have more like I joke with you and I often say, like, I hear it here, like it's in my brain, but there's like a disconnect when I could often stand there and I'm like, what was I going to say? Or I can think it, but it's not actually. So there's a lot of that brain fog is gone. A lot of the, motivation is back. A lot of the energy is back. A lot of the, dare I say it, sex drive is back. I just feel, I feel like my old self again. And, these things happen so slowly over time that I don't even think I understood or had an awareness around the detriment until I started feeling better.
Mm-hmm.
And so
Yes.
Me personally, I will never be without the pellet from this point forward in my life. But I want to segue into something that very serious. And I want you to talk to our friends today about, I myself am a 2-time cancer survivor. So naturally going into this process, I had a lot of questions. Right? How much did I bug you about this, about the cancer and the risks?
And rightfully so.
So, what would you say to, your patients who come to you? I mean, what advice did you give me? What advice would you give them about their concerns around, the hormones?
It is a very controversial issue, and there's a lot of mixed data out there. But according to the data with low dose natural hormones, there are no studies to date that show that it causes cancer. In fact, if anything, it does the exact opposite. So, and even getting into, not even to get into the specific studies, because I will in a second, but at our office, we are crazed about that. I mean, we really keep our patients on a short leash and they complain about it. And, I just tell them, hey, look, we need to stay on top of your health. They don't cause cancer, but if you have a hormone dependent cancer, you don't want to give yourself hormones, so we make sure that you are in a clean bill of health. With the men, we'll do the PSAs. I make sure that they have yearly your routine checks with the urologist. For the women, pap smears, mammograms,
Cholesterol,
the cholesterol,
bone density,
ultrasound. So we really make sure that your body is okay, and we're not putting you at a risk, because, like I said, it can cause a current cancer to grow. So we just want to be clear on that. But getting back to the hormones and hormones causing cancer, yes, there was a huge study that came out on Premarin back in, I think, around 2005, where they found that the higher dose Premarin, and Premarin's made from a pregnant horse's urine, and they found that Premarin increased a woman's risk for breast cancer. So in retrospect, they found that to a horse has like 10 different types of estrogens that's normal for its body, but wasn't really normal for us humans. And a specific type of estrogen called estrone was very high in Premarin. And it was the estrone molecule that was shown to increase a woman's risk for cancer, for breast cancer. Now, we check estrone levels. So if we start seeing that climb up, we jump on that. We jump on it as far as putting patients on supplements. And I've jumped on your case too about taking your supplements in the estrone.
It's true. It is. It's true.
But it's like, you stopped what? Anyway. But if you do like a PubMed or Medline search, you'll actually find that, for instance, progesterone has been associated with a decreased risk of breast cancer. But that's natural progesterone, not progestin, which is synthetic progesterone. So please know the difference. Progestin is synthetic progesterone, and there's progesterone. A lot of docs will interchange those and just say progesterone, but they really mean progestin. So it's clear. I want you to be clear that we're talking about progesterone natural. Anyway, estriol, which is another type of estrogen, is now in clinical trials on breast cancer survivors. And the preliminary studies are showing that it actually decreases one's risk of reoccurrence for breast cancer. So there's a lot of good studies coming out, and a lot of good studies out there that show that it's really the natural way is showing the exact opposite of the synthetics as far as your breast cancer risk.
I just want to add to that. One of the other things that we do, I think, is really important that I have not found, like people coming over to us, there's been a handful of them. Their doctors are not repeating that blood work in between the pellets. So in our office, what we do is 6 weeks. So whether you're a male or a female, and some our females get their pellets every 3 months, depending on their blood work. And our males get theirs every 4 months. But it's always at that 6-week marker we want to know. And I'm a prime example. Now that my body is starting, my receptors, just like you said, are starting to say, hey, this is what we're supposed to be doing. We have to make some modifications to my prescription. So, and that's why you always want to do that. You always want to have that blood work in between. That it's a little annoying. I get it. It's annoying. It's a little annoying to have it done, but it's so much, you want to have the most data that you can so that you're not giving your body too much of something it doesn't need. So, I love that we have all these precautions in place. Like you said, we really do take those extra measures. So I heard that testosterone causes heart disease. Is that true?
No. In fact, there was a study that was published by the Mayo Clinic in 2015 that said the exact opposite, that testosterone actually helped and decreased cardiovascular disease. So there was no evidence to show that there was an increased risk. We have testosterone receptors on our heart, but In fact, it actually decreased it. And a lot of, especially in the older men with congestive heart failure, we'll put them on testosterone, and studies are showing that there's an improvement on their congestive heart failure. So fascinating stuff, new topic, new research, more research probably needs to get done on this, on all the benefits of hormones as far as reversing cardiovascular disease.
So, it's interesting, getting back to the pellets for a minute, are they regulated by the FDA?
Great question. No, they're not regulated by the Food and Drug Administration because made. They're not a drug. They're plant-based. They're made by a compounding pharmacy, and the compounding pharmacy is strictly regulated by the government. They have to have a specific certification, and it's called a 503B. And to get that certification, it's very difficult, very difficult. A lot of compounding pharmacies went out of business as a result of this because they couldn't keep up with the regulation and the high costs to get this certification. But they are audited frequently by the government. Surprise audits occur. What's coming out of their pharmacies they have to be tested by a separate facility to make sure what they say is in there, and with the correct dose. So that's how they're regulated.
Okay. So I've been pretty open about my experience. I'm going to out you for a second. You're on pellets as well. In fact, we started at the same time. How do you feel about sharing your experience a little bit with our friends?
Well, the pellets for me too have been a game changer. And that's why I feel I'm so passionate about this, because I want everyone to feel as good as we feel.
Yeah.
The cream and the patch, they got me I guess probably 70% better, but I wasn't totally there. But now, and I started feeling the results, I guess, within a week of my pellet. I started having more energy. My workouts start to become more efficient. I started to sleep better. After a couple of weeks, my sleep, I was like, wow, I'm sleeping through the night. This is great. I have more, and as a result, I have more energy because I slept. I wasn't tossing and turning throughout the night. And now, because I have more energy, and my workouts are becoming more efficient, and I've always been a good eater, I'm starting to see my fat coming down. We do the body composition analysis, and as everyone knows, fat is the last to get released in a weight loss system. But I'm losing weight, I'm losing fat, and it feels great, and it puts me in a better mood. And speak of mood, taking care of two elderly parents, being a wife, being a mother, being a physician, having an office, I'm pulled from all directions. There's never any downtime, and I'm able to handle that better. And my coworkers are saying that, I'm definitely less stressed. I mean, going through this whole COVID situation and craziness, they're like, God, you handled that so much better than you would have in the past.
You have.
It's been great. It's like I said, it's been a game changer for me. And I absolutely love the pellets, and I'll never give up my pellets again.
That's how I feel. And I probably should mention, I lost 8 pounds in the first, I guess, what was it? The first round I did it. So it was the first 3 months that I was on it. I lost 8 pounds. Again, I did the peptides with it, which is
the mix shots, all that.
Yeah. And we'll do a follow-up, Facebook Live on the pellets and how, we intertwine that stuff with all of this. So what's involved with a pellet insertion? Can you just tell them what you talked a little bit, very briefly before that it's an incision, right? It's a procedure.
Mhm.
Can you
Yes.
tell us what that
It's
looks
a
like?
sure. It's a procedure, and probably takes 10 minutes to do. And I think half of that time is waiting for the area to get numb. But the area is numbed. It's in your buttocks area. A small incision, 1 centimeter, is obtained, and the pellet is inserted under the skin. The size of the pellet, it looks like the size of a pen head or a pinhead. And the incision is, yep. And the incision is steri-stripped. There's no sutures, there's, no stitches needed. Um, and I have to tell you, the delivery system, we use the Pelicom delivery system, and it's absolutely phenomenal. If you had 10 physicians lined up with the scalpel in hand, and you told them to make a 1 centimeter incision in the skin, every 10 physicians would have 10 different levels of thickness, through the skin. None of us would have the exact same depth. This system, it's dummy proof. We all would go, because you can't go any further. It goes to the perfect depth underneath the skin, and then it injects that pellet right underneath the skin. So it's located in a perfect location. So I'm so excited to use the Pelicom system. And the scarring, it's very minimal. It's a dot on the skin. And I love it. I really love it.
I have seen some other, I have other friends who have done this, and the scarring from someone not using, such a precise system, you can tell like her scars are all different sizes. And, like you said before, if there's 10 different physicians, performing the same thing with, just rogue, then you're going to have some of that. I realized that I didn't invite all of you during the course of this to as often as I would for your questions. I just want to reassure you, if you have any questions, we'll, as soon as we're wrapping up today, we're going to go on and check for you. If you have any, please don't feel funny. Pop those in below. Let us know what it is you're curious about. This is, as Doc said, this is not a new thing, but there's a lot of new technology around it. It's starting to become, as the myths that are dispelled about it, it's started to become something more and more popular. We, as I said, we do this here at Origin Wellness Center. Doc and I are very, very excited to bring it to our community, as we have used ourselves as guinea pigs to make sure it really works first. And I just want to say, I hope today's live has been informative. Just stay tuned. We are going to break down today's conversation more extensively, where we're in talks right now about breaking it down about how women, and Doc, do you want to talk about that? Maybe how we're going to break this down?
Yes, absolutely. Well, we're gonna do another Facebook Live on just female hormones, female health, the different types of estrogens, progesterone, testosterone, what they do in the body, how they interact with one another. We'll go into the building blocks of our hormones. We'll also go into the metabolism of our hormones, what influences the metabolism in a healthy versus an unhealthy way. And then we'll do another Facebook Live on the male hormones and how it affects the men, and what what we should be looking for men. And men have the same hormones as we do, that just it's different ratios. Obviously they have a higher testosterone than we do, whereas women have higher estrogen or higher progesterone than the men do. But we all have the same hormones. It's just the different dosing or the different levels in male versus female. So we'll talk more about that. And then eventually I want to talk about the adrenal glands, our stress hormones. Everyone knows, and Bernice, you could probably attest to this. I know I can. When I was on the cream and the patch, when I got stressed, like if somebody came into my office and told me something that upset me, I could feel the flash. I could feel it coming, and the sweat would start. So stress hormones, will definitely influence our female hormones.
Yeah.
So we could talk about that. We could talk about thyroid. I love talking about thyroid too. So many,
Yeah.
docs are not fully trained on thyroid. As a functional medicine provider, we do a more extensive look at the thyroid and the different types of thyroid hormone, and how it affects the body. So, thyroid hormone, adrenal glands, female hormones, they all work together. It's like a web, or a symphony, if you will, like where every instrument has its part. So we could talk about each of those as well.
And I talked earlier, I love so much that you brought that up, because I often don't think that people get the gravity of stress and how it plays a role in the web. I myself, coming into this, I said very briefly earlier that I was going through extremely difficult personal time in my life. And I didn't really understand the impact of the gravity that it was having on this other stuff that was happening. And I just, I thought it was all like normal. I thought that this was just like normal, and I was accepting the symptoms as part of what a woman goes through. I didn't really know that there was an answer. I didn't really know that I could get relief from the symptoms.
People say, oh, it's just normal aging process. Well, it could be, but no, it's just an imbalance, and you just have to figure it out and correct it.
Yeah. And it was just about talking to my doctor and saying, these are the symptoms that I'm having.
And also, I do want to mention with you, Bernice, being a health coach, has helped me tremendously, as far as handling my stress. Everybody around me, demanding my time and trying to put my best efforts. And she showed me a lot of, how do I handle the situation of stress versus not being stressed. And she taught me on how to compartmentalize and what to do and what my goals are. So that's really helped me too in this journey of life that we all go through.
So in addition to the Facebook Lives that we will be rolling out, guys, really stay tuned, plug into us. I'm going to be putting a lot of information out in the next week in terms of a new group, in terms of membership, in terms of these additional Facebook Lives that we talked about. There'll be quite a few things, as I said, that we roll out this week. I hope this information has been enlightening. If you are in need or would like to reach out and talk about pellets, if I can answer any questions for you, please either drop something in a private message to me, or reach out to us at Origin Wellness Center. And we're happy to get you set up for a consultation to see where you can get started on your journey for pellet health, hormone health. Doc, you have anything you want to add?
No, it just that we are going to have a private, a group, and free. And so we'll have a lot of our videos that will be in archive. We'll have new videos. And then also we'll be able to generate quite, because maybe your question you may think is different, but in reality, it's not. And a lot of patients ask the same question. So it's always nice to be in a group where we're all sharing our experiences and sharing our questions, because more than likely someone else has that same question. And so that's what I love about this new and exciting venture that we're going to eventually do.
Yeah, I mean, and the funny part was that I wasn't talking about it. I wasn't really necessarily speaking up or saying, because in my mind, I was normalizing it, as I said, as something that women go through at their age, at this age, I'm 51, in case I didn't say that. So, but this, as we said earlier, this can happen at a much younger age. The imbalance, it's just natural. It's just more natural at this age. So thank you so much for joining us today. Doc and I, as you can see, are very passionate around this topic. As I said, please, if you have any questions, drop them below, let us know. And as soon as we're offline today, we'll be looking for those. Keep your eyes open in the next week for additional information on our Facebook Lives, on our membership and our groups and things like that. And I hope to see you all soon. Stay safe. Stay safe and be well.
Take care. Bye-bye.
Bye.